Okay, to continue with our topic 1 for pharma, so when we deal with giving drugs, it's also important that we follow the nursing process. So, i-assess mo yung patient. Ano ba yung level of pain niya? Diagnose mo, meron siyang acute pain. Planning, anong ibibigay ko sa kanya, anong gagawin ko sa kanya para mabawasan ang pain. And one of which is giving pain meds. Implement is to administer the pain medication. Magbigay rin ako ng health teaching about the drug. Ito po ay para sa mild pain. Better po ito kung ibibigay ko sa inyo at ititake nyo ng empty stomach for better absorption, blah, blah, blah. Evaluate kung nabawasan ba yung pain. So, even with giving drugs, we still follow the nursing process. Okay? Now, take into consideration that when we give drugs, patients has several rights. There are 10, 5 traditional, 6 additional. Meron akong ibang nakikita na sa ngayon, there are already 14 rights of drug administration. So, sa additional muna tayo, right assessment, right documentation, right to education, right evaluation, right to refuse. The patient can refuse kung talagang ayaw niya, but you have to document. Yung iba pa, meron ng right approach, right principle of care, right prescription, right nurse clinician, because in other countries, may mga nurses na pwedeng mag-reseta ng drugs, no? But we focus now on the 5 traditional. Ito yung pinaka-importante. Okay, right client. Of course, you should always know your patient. Pag nagtatanong ka ng pangalan ng patient, wag mong tatanungin na, kayo po ba si Juan de la Cruz? Kasi yung patient, minsan magnanod na lang. Kahit hindi naman pala siya si Juan de la Cruz. So, which is better, you have to ask the patient the name. Okay? O kaya tignan mo mismo yung name tag niya na naka-attach sa katawan. Pero kung ang tagal-tagal mo ng patient yon, 10 araw mo na siyang patient, syempre dapat kilala mo na yung mukha niya. Hindi mo naman araw-araw tatanungin yung pangalan niya. Okay? Right drug. Sino lang ba yung pwedeng magbigay ng prescription? Physician, dentists, and again, meron ng advanced practice registered nurse in other countries. No? When administering or when prescribing drugs, generally written siya. Okay? Pirmado nung nag-order. Pero pwede din siyang telephone order or verbal order. Nurses can write them, but kailangan siyang mapirmahan, no, ma-countersign ng doktor within 24 hours. Paano kung nasa abroad yung nag-telephone order? In the hospital, meron namang mga residents or other doctors under the same care, so kailangan siyang i-countersign. Okay? Components of a drug order, kailangan may oras, may date, no? Yung number 2, ito yung standard. Dose, route, frequency. Minsan, okay lang na walang duration, pero yung dose, route, frequency, dapat meron yan. Okay? Kung babalikan natin ito siya. Digoxin, 50 mg, Q8, IV. So, example lang. Ulitin natin. Digoxin is the name of the drug. Dose, 50 mg. Route, IV. Frequency, Q8. Yan yung hindi pwedeng mawala. Name of the drug, dose, route, frequency. Okay? Kung halimbawa naman, kunwari, biogesic, 500 mg is the dose, route is per orem, frequency Q4. every 4 hours. So, dose, route, frequency. Paano kapag may duration? Minsan may duration. So, for example, this one, digoxin, 50 mg IV Q8 for 3 days. Something like that. Or, biogesic, 500 mg per ORM Q4 times 7 doses. Kunwari lang. So, 7 beses mo lang siyang ibibigay, yung isa 3 beses o 3 araw mo lang siyang ibibigay. So, merong duration. Okay? Sometimes wala nang duration. Ang dapat lang lagi na meron, dose, route, frequency. Yung number 3, special instructions. For example, biogesic for fever 38 and above. Something like that. Or furosemide 10 mg IM Q12 if BP is higher or equal to 120 over 80. Something like that. Pero kung walang special instruction, the nurse should know when to withhold or adjust the dose. Okay? Like yung furosemide nga. No? Furosemide, you should always check the blood pressure before giving it. Furosemide is a diuretic, and that diuretic will lower the blood volume. If it lowers blood volume, it can also lower the blood pressure. So when giving furosemide, you should check for the blood pressure before giving it. So yun yung mga example ng mga special instructions. And of course, name and signature of the physician who ordered the drug. Categories, pag sinabing standing order, lahat ng gamot na kasalukuyang tinitake ng patient. So, mga standing order yan. Kung diniscontinue na, hindi na siya kasama doon. One time or single order, give paracetamol now. So, pag sinabing now, one time lang siya. Yung loading dose, no? Loading doses, it's a one time or single order. PRN, as necessary. For example, paracetamol lang pag merong lagnat. For stat order, it is of utmost priority. Ibibigay mo siya right then and there. Kung marami kang pasyente, maraming gamot, may stat order to, uunahin mo siya. Okay? Drug distribution for the right dose, stock drug, no, yung isang gamot nandoon siya sa isang container. Unit dose nasa isang banig. So when we are dealing with safety, mas malinis ang gamot, walang contamination, unit dose yung best. Pag stock drug kasi, nandoon lahat sama-sama sila. Okay, right time. This is important. OD once a day, BID 2 times a day, TID 3 times a day, QID 4 times a day, Q is every. Okay? What I want you to remember here is magkaiba ang BID sa Q12. Okay? So, kunwari, BID versus Q12. Okay? Pag sinabing BID, 2 beses mo siyang ibibigay only during waking hours. At ang waking hours, usually, no, 8 a.m., tapos yung susunod na dose ay 6 p.m. Pwede yon. Pero, kapag Q12, 2 beses din siya sa isang araw. But the in between, no, should be exactly 12 hours. Yung pagitan ng pagbigay ay dapat 12 hours. So, kung halimbawang binigay mo yung gamot ng 9 a.m., dapat yung susunod na dose niya 9 p.m. kahit tulog na yung patient. Or, Kung binigay mo yung gamot ng 12 p.m. nung una, yung susunod na gamot dapat ay 12 a.m. Okay? Unlike yung BID, only during waking hours, which is the same with TID versus Q8. So yung TID, 3 times a day during waking hours. So pwedeng alas 8 ng umaga pagkagising, alauna ng hapon pagkatapos mananghalian, or alas 6 ng gabi bago matulog. Pero pag Q8, dapat yung pagitan ng pagbibigay ng gamot ay exactly 8 hours. Kung inumpisahan mong ibigay ng alas 8 ng umaga, anong oras dapat susunod na ibigay? After 8 hours, which is 4 p.m. After 4 p.m., kailangan 8 hours ulit, which is 12 midnight. So kahit tulog yung patient, bibigyan ko siya ng gamot. Unlike TID, only during waking hours. It's also the same with QID versus Q6. Yung QID, bibigay ko lang siya during the day. So, pagkagising ng umaga, alas 8 ng umaga, alas 12 ng tanghali, alas 4 ng hapon, alas 8 ng gabi, bago matulog. Pero kapag Q6 yan, 4 times a day din. Pero dapat yung pagitan nila exactly 6 hours. So halimbawa, alas 8 ng umaga binigay, after 6 hours, 2 o'clock. After 6 hours again, 8 p.m. After 6 hours again, 2 a.m. So kahit madaling araw, gigisingin ko siya para ibigay yung gamot. Okay? So magkaiba yung konsepto ng BID, TID, QD kesa dun sa mga Q. Okay? And also remember to use universally accepted abbreviations. In your book, you will see there ano lang yung mga tamang abbreviation, no, na dapat nababasa natin at sinusulat natin sa chart. Right route, pag oral, nilulunok. Sublingual, sa ilalim ng dila. Buccal, sa gilid ng pisngi or sa cheeks. Transdermal, idinidikit sa skin. So when you give drugs via transdermal, ang unang-unang importante doon ay kailangan walang buhok. So minsan may mga angina transdermal patches. Yung lalaki may chest hairs. So you might need to shave the chest area. Okay? Topical, so sa skin. Protect yourself. You can wear gloves or use cotton pledgets when putting on topical drugs sa patients. Instillations, pag eye drops, ipinapatak sa lower conjunctival sac. Pag eye ointment, lower conjunctival din, pero inner to outer canthus. Okay? Pag ear drops, kailangan kung nasaan yung tenga na paglalagyan ng gamot, yun yung naka-expose. Nose drops, hyperextend the neck. Nose sprays, kailangan singhot. Okay? Anyway, itong mga gamot na ito, nandun ito sa yung pagbibigay ng gamot ay ituturo sa inyo sa skills nyo ngayon sa medication. Inhalations like nebulizations, no? Gastric tubes, so giving of drugs via NGT, OGT, and gastrostomy. So kung yung gamot solid form, pwedeng i-crush or pwedeng alisin from the capsule, except for drugs which are enteric coated. Kung enteric coated, hindi pwede yon. Okay? Suppository, rectal, vaginal, and then the different parenteral routes, intradermal through the skin, subcutaneous through the fats, intramuscular through the muscle, Yung Z-track, it's a special type of IM injection which prevents backflow of drug injected into the muscle up to the fats para hindi nagba-backflow yung gamot sa mga IM and intravenous. So ngayon, ang skill ninyo sa RLE, intradermal, subcutaneous, intramuscular, yung IV sa higher years. Okay? And this is the last slide. So, the herbal therapies. Yung mga halamang gamot na approved ng DOH. Your books have herbal drugs, but those herbal drugs are US-based plants. No? Dito sa Pilipinas, 10 pa lang yung DOH-approved medicinal plant. Ang mga gamot na ito ay madaling hanapin sa mga um, probinsya or bukid o sa gilid-gilid, madali siyang tumubo. It's either you get the leaf or uh, nilalaga siya, kinukuha yung katas. So, depende, iba-iba. Okay? Lagundi, herbabuena, sambong, tsaang gubat, niyog-niyugan, akapulko, ulasimang bato, bawang, ampalaya, and guava or bayabas. So, self-explanatory, nandyan kung para saan siya, yung indications niya. The ideal purpose of having this is so that the poor people o yung mga ibang patient, pwede lang ring kumuha madali na source. Pero uh, ngayon meron ng lagundi, zero. Meron ng mga ampalaya na nabibili na rin na naka-pouch. No? But anyway, so ito pa lang yung mga DOH approved. Marami pang inaaral na mga medicinal plants. But as of now, sila pa lang yung natapos yung pag-aaral at napatunayan na effective siya at safe siya. Okay? So that's the end of our topic 1 in pharmacology and study further. You can read the books with the topics that I have also discussed to further enrich yourselves with the basic concepts or the general concepts of pharmacology. Okay?